So let's proceed to lesson 2, part 2. This time we're going to talk about outpatient care methods of delivery. So we're now going to talk about outpatient care services that are not given in any particular or required to be given in a particular type of facility. First, we're going to talk about mobile medical services that are part of outpatient care settings. So ambulance service and first aid treatment provided to the victims of severe illnesses, accidents, disasters by trained emergency medical technicians are the most commonly encountered mobile medical services. Even specialized ambulance services such as mobile coronary care units and shock trauma vans are becoming increasingly prevalent. In some situations, mobile eye care and dental care units are efficient and convenient means for providing such services. These mobile units are often brought to nursing home sites where a large number of facility residents can be served, serving frail elderly patients, and then it saves them the inconvenience of having to make difficult trips to regular clinics. Mobile diagnostic services include mammography and MRIs, magnetic resonance imaging, and such mobile units take advantage or take advanced diagnostic services to small towns and rural communities. They offer the advantages of convenience to patients and cost efficiency in the delivery of diagnostic care. Screening vans staffed by volunteers or trained professionals and generally operated by various nonprofit organizations are often seen at mall and fair sites. Various types of health education and health promotion services and screening checks such as blood pressure and cholesterol screenings are also commonly performed. Now, a telephone triage system provides telephone access to bring expert opinion and advice to the patient, especially during the hours when physician offices are generally closed. So the telephone call-in system operates 7 days a week, 24 hours a day. A system is staffed by specially trained nurses who receive patients' calls. Using a computer system, they can access a patient's medical history and bring up the most recent radiology and laboratory test results, for instance. The nurses use standardized protocols to guide them in dealing with patients' problems and consult with primary care physicians whenever necessary. Now, these are the different types of services in home care. So nursing care, some of them could be very clinical. Some of them can actually be, just like activities of daily living, assistance, things like that. But you could also be, like, it could be a rehab visit. Like I said and mentioned earlier, it could be a primary care visit too. Home health is consistent with the philosophy of maintaining people in the least restrictive environment possible. So services are brought to patients in their own homes, and most people would prefer to live and receive health services at home than be institutionalized. Home health services typically include nursing care, changing dressings, monitoring medications, providing help with bathing, short-term rehab, physical therapy, occupational therapy, speech therapy. So they could also receive help like homemaker services, meal preparation, shopping, transportation, certain chores, durable medical equipment, hospital beds, oxygen tanks, walkers, wheelchairs. They can all be provided by home health care. Certain specialized high technology home therapies that were once available only in hospitals are now delivered in the home. These specialized services include intravenous antibiotics, oncology therapy, hemodialysis, parenteral and enteral nutrition, and ventilator care. The next type of method of delivery is hospice care. So hospice includes a cluster of comprehensive services for the terminally ill with a life expectancy of 6 months or less. Hospice, in this case, is a method of care, not a location. That's why it is a method of delivery. Hence, services are taken to patients and their families wherever they happen to be located. Hospice regards the patient and family as the unit of care. So it's not just the patient, but the entire family as well. So comfort and quality of life, rather than prolongation of life, are the main goals of hospice care. And the two primary areas of emphasis in hospice care are pain and symptom management, also referred to as palliative care, and psychosocial and spiritual support. All healthcare services given in a hospice care center can be given in a home setting, including medical, psychological, psychiatric, and of course spiritual and social services. And providers who specialize in hospice care are called palliative care specialists, and they emphasize pain management. Public health services. So there is no consistent pattern for the scope of services offered in different geographical sectors of the country. Generally, public health programs are limited in scope. They could include well baby care, sexually transmitted infection treatment, detection and treatment, family planning services, screening, treatment for tuberculosis, and ambulatory mental health. Health departments in poorer communities tend to have very limited scope of services since they are mostly funded by local taxes, similar to school districts. So if you happen to live in a rich city where property taxes are higher, for the most part, their health departments might also be more have extensive services. Many health departments also provide home care services, usually through a public health nursing division. As a general rule, public health programs offer services that do not directly compete with those provided by private practitioners. Typically, such services are restricted to those areas in which private practitioners have little interest, or they are targeted to serve inner-city, poor, and uninsured populations. School health programs in public schools fall under the public health domain, but they are limited to vision and hearing screening and assistance with dysfunctions that prevent learning. School health programs here in New York, for instance, tend to be more comprehensive than this. Montefiore operates a school health program in certain public schools. And the public school setting is a growing area of practice for physical therapists, occupational therapists, and speech and language pathologists. And these therapists help children with special needs, special physical and emotional needs. Ambulatory clinics in prisons also fall under the public health domain. Community health centers, one of my favorite topics. So community health centers play an increasingly important role in the U.S. healthcare system. It was launched in 1965 as a small experiment in bringing comprehensive primary care to rural and urban medically underserved communities. Since then, health centers have grown steadily over 5 decades, and following studies showing their effectiveness, not only in creating access to healthcare, but in improving health on a community-wide basis, also known as population health. Today's health centers offer a wide range of services, spanning a full spectrum of care for conditions that can be successfully managed in community settings. Services found at health centers range from basic preventive medical and dental care to advanced treatment for serious and chronic physical and mental health conditions. Community health centers, also known as CHCs, they operate under the direction of the Bureau of Primary Health Care, Public Health Service, and Department of Health and Human Services. They provide comprehensive ambulatory and social services to the poor living in inner cities and rural areas, and the non-poor living in medically underserved areas. They are typically staffed by a salaried, multidisciplinary team of professionals, and these clinics are pioneers in the training and employment of nurse practitioners and physician assistants. Many community health centers have affiliations with hospitals for specialized services in inpatient care. So those patients that they see that are needing more intensive care and inpatient care, then it's easier if these community health centers are affiliated with health systems, because then it's easy to refer their patients. The majority of funding for the operation of community health centers comes from Medicaid and the various public and private grants. Medicare, private insurance, and private out-of-pocket payments make up the rest, and private out-of-pocket payments are based on sliding fee scales. Some basic facts about community health centers. Health centers are an important source of primary care for Medicaid and uninsured patients. Um, Utilization of certain preventive services by health center patients have increased in recent years, and they serve a large and diverse patient population. Studies have also shown that growth in the number of health centers over time can lead to substantial increase in the number of patients who receive care. Medicaid and federal 330 grants, these are the grants that are given out by the government, are the main sources of funding for community health centers. Health centers are also major employers in their communities because they employ salaried personnel, medical personnel. Um, there's this thing called the National Health Service Corps. Uh, they provide scholarships and loan repayment assistance to support training of primary healthcare, medical, and dental professionals. So if you're willing to work for a community health center that is situated in a federally underserved area, medically underserved area, the National Health Service Corps can actually reimburse you or uh, give you money for loan repayments. So another type of method of delivery is free clinics. So free clinics are general ambulatory care centers serving primarily the poor and the homeless who may live next to affluent neighborhoods or in rural areas as well. There are only 200 or so such clinics across the country, and care is given for free. They could do some sliding fee scale charges, but for the most part, it's really free, and staff's mostly volunteer or medical students. Um, these clinics really face serious problems because there's not much funding available. They're not directly funded by the government or the health department, so usually it's funded by private foundations. And they're modeled after the 19th century dispensary, those free clinics staffed by physicians under apprenticeship training. Um, we have one example for this type of clinic in New York City, and it is NYU's free clinic. So let's visit this website, and here it is. So it's actually operated by NYU. It's directly under the medical school of NYU. You could visit this website, just copy this if you think this could be a good resource, for anyone or for yourself. Sorry. So alternative medicine clinics, they're the ones that do complementary medicine. So what are these? What are the types of services that they give? So you have homeopathy, herbal formulas, all of these that are enumerated up here. Now, alternative medicine, also referred to as complementary medicine, non-conventional therapy, natural medicine. It refers to the broad domain of all healthcare resources other than those that is fundamentally part of biomedicine or Western medicine as we know it. They're regarded as non-traditional because the efficacy or how effective the treatment. Many of them have not been scientifically established. That's why a lot of alternative medicine is not really officially recognized by conventional Western medicine. Most people who seek out alternative therapies believe that they have already explored, all aspects of Western medicine, for their illnesses, for their chronic illnesses. So yeah, you'll find like a lot of cancer patients, for instance, that turn to this as well. Alternative treatments include homeopathy, herbal formulas, use of other natural products, such as preventive and treatment agents. and acupuncture. Sometimes meditation, biofeedback, spiritual guidance, or prayer, they're also included. Chiropractic medicine, even though largely separate from the mainstream uh, of modern medicine, they're actually, as we have mentioned when we talk about health professions, that it has been increasingly recognized for its healing values. But just like any other complementary medicine, there's still much research that needs to be done to support, the effectivity of or the long-term effectivity of chiropractic medicine. So this is the end of lesson 2.